Today I've been responded to a 20-year-old male whose chief complaint is severe abdominal pain. We have gone in and seen the male and we have taken some vital signs, but haven't done a full assessment yet. The vital signs show that his heart rate was 80, his blood pressure was 110/70, his SpO2 was 99%, and his temperature was 38.5, which is a little bit high for the normal body temperature of an adult male, or adult in general. So this could mean that there's an increase due to the pain or something that's going on within his gastrointestinal abdominal region.
Hello sir, I'm Jessie from the ambulance. What's your name?
Brandon.
What's been going on today? Can you tell me what's happening?
A lot of pain in my
You're in a
stomach.
lot of pain in your stomach? Yeah?
Mhm.
How long has this pain been happening for?
Obviously last night.
Last night? Yeah? Okay. Does the pain travel anywhere at all, or does it stay in that one localised place?
Oh, it's just up the side.
Just up the side? Up that side? Up the right side?
Yep.
Yeah? Okay. Have you been to the toilet at all today?
I haven't stopped.
No, you haven't stopped?
No.
Has it been watery?
Yeah.
Watery, yes? Like diarrhea, kinda? Yeah. Have you ever had this pain before?
No.
No?
Not like this.
Okay, so what we might do is lie you down, okay, make it a bit more comfortable for you because sitting up is going to make it worse. So if we just lay you down on your couch here, just take it slow, take it easy.
Oh, no.
Yeah, just take your time. Just get yourself comfortable, we might have to shuffle around a bit.
Yeah. Oh.
Okay. Can you move up a bit more?
Yeah.
We want to get you in the supine position, so we want the patient to be with his legs up. And I'm just going to put your hands by your side. I know it's painful, you're just going to have to stay like that.
Yeah.
Okay. So it's just staying on the right side, travelling up a little bit. What have you eaten today, and what did you have to eat last night for dinner?
Nothing.
Nothing?
No.
Nothing at all?
No.
Have you been eating, so you haven't been eating or drinking?
Nah.
For how long now?
Since just after lunch yesterday.
Just after lunch yesterday? Yeah? So, I'm just going to have a look at your belly, right?
Yeah.
And I'm also just going to look in his eyes and around his arms and legs and everything for any abnormal bruising or discoloration in the eyes, because this can give signs that something may be happening abdominally. It doesn't always just have to show on the abdomen, it could be happening anywhere else in the body. So it doesn't look, can you just open your eyes for me? So his eyes look normal, there's no yellow pooling or discoloration. I'm just going to pull your top up a little bit if that's okay. Just have a look at your tummy. So just put your arms down by your side. So his stomach is a little bit distended, just a tad. So what I'm going to do is I'm just going to palpate your stomach, okay? So I do have to push down a little bit, and you're just going to tell me where it's sore, okay? A little bit sore there?
Yeah.
Yeah? What about in the middle? Around here? I'm just going to palpate your kidneys. A little bit sore around your appendix as well? Yeah?
Yeah.
What about in the middle? No? Just going to also percuss the abdomen. So by palpating, what I'm doing is I'm able to feel for any rigidity, softness, hardness of the abdomen. Also by looking at the abdomen straight away, you can see for any scarring, any bruising anywhere. Have you been needing, so have you been peeing normally? Has it been a different colour?
No, just the other one.
Yeah, just diarrhea?
Yeah.
Yeah?
Bad.
Have you been feeling nauseous at all?
No, just a lot of pain.
A lot of pain? Have you been, is this pain making you feel quite dizzy?
No.
Have you been having a little bit of like blurry vision at all?
Yeah.
Yeah?
Yeah.
Blurry vision? Okay. So after we complete the abdominal examination, we're going to do a neurological examination as well, because the patient has been having blurred vision. We just want to rule out any signs of stroke or anything like that. So I'm just going to palpate, okay, percuss the abdomen. So we're just listening for any dull noises, high-pitched noises at all. Just going to percuss around the sore side. Is that sore?
Yeah.
Yeah?
Yeah, that's all.
That's sore? Okay.
Mhm.
So you can clearly see that the pain is originating around the right hand side, moving up a little bit to the upper half of the right hand side of the abdomen. Okay. So what I'm going to do is just sit you up a little bit.
Mhm.
Okay. We might just kind of get you into like a reclined position.
Mhm.
Okay. So I can do the neurological examination. But just sit up a little bit. Take your time. So I'm going to get you to sit back up against this part of the couch here. Right up against the back of it. That's it. Keep going. That's it. And you're just going to lay back a little bit for me. Keep your legs up. Is it better with your legs up?
Oh, I can have this one done.
This one?
This leg.
This leg?
Yeah.
Okay. So I'm just going to do a neurological examination now as well. So we've done our abdominal gastrointestinal examination. So we're going to just now rule out any signs of stroke or anything that may be going on with the brain that could be impacting the pain in the stomach. So I just want you to open your eyes for me. We're going to do a thing called a FAST test. Okay? Face, arms, speech. Okay? So you're going to give me a big smile. Awesome. You're going to just bring your arms out. I know it's painful. Keep your arms up. That's it. Close your eyes. Keep your arms raised. That's it. Good. Now turn it around so the palms are facing upwards. That's it. Open your hands nice and wide. Good. Now I'm just going to ask you a few questions and I'm going to get you to count to 10. So can you count to 10 for me?
1,
Yep.
2, 3,
Yep.
4, 5, 6, 7, 8, 9, 10.
Good. Awesome. And I'm just going to ask you 3 questions. Do you know where you are at the moment?
Yeah, at home.
At home? That's it? Good. And do you know what country you live in?
Yeah, New Zealand.
Yeah. And do you know who the Prime Minister is?
Yeah.
Yeah, Jacinda?
Yeah.
Yeah. Good. Okay, so
Sorry.
you passed the FAST test, which is good, so we can rule out any signs of stroke. I'm just going to do a vision test as well. So I'm just going to get you to put your hand over one of your eyes.
Yep.
Okay? And I'm just going to bring my fingers out here. Can you see my hands?
Yep.
That eye, yeah. And the other eye. So you're going to put your hand over the other eye. That's it. You see my hands?
Yep.
Yep. There's no discoloration.
No.
You can see colours and everything. It's just a little bit blurry because of
Yeah.
the pain.
Yeah.
Yep. No worries.
So after completing my abdominal and neurological examination of my patient, I was able to rule out any more serious issues that I was not ruling out at the start when I first saw the patient. When doing my abdominal examination, I was looking at all the possible underlying issues that he could be having. So he could have had irritable bowel syndrome, pancreatitis, cirrhosis, he could have gallstones, kidney stones, appendicitis, cancer, irritable bowel syndrome, which is very common in younger people. Because my patient was locating his pain from the right upper quadrant to the right lower quadrant, this pain is more commonly seen with people with appendicitis. So I was more looking at the fact that he could be having, he could have appendicitis and he could be having issues with his appendix. I also completed my neurological examination of my patient because he was having blurred vision. I wanted to rule out any signs of stroke. So when I was doing my neurological examination, I made him smile. So this checks for any facial droop or facial paralysis. There was no facial paralysis or droop from the patient. He was able to smile completely normal. I asked him to count 1 to 10 and I asked him multiple questions. This helps to show that there was no slurred speech and that there was no confusion. He knew exactly where he was and what was going on and why he was in pain. I also made him raise his arms and he kept them raised with his eyes closed, which is really good. It shows that there's no loss of function within his arms or motor function. And I also got him to do a grip strength test, which I wasn't able to capture on film, but afterwards he did the grip strength and that was absolutely normal. There was no loss of grip strength in either arms. The patient had good grip strength. When I was completing my abdominal examination, I was doing percussion and palpation. You can also auscultate the abdomen. By auscultating the abdomen, that allows you to hear for any abnormal gut noises, if there is like a tinkering sound, or if there's absent noises or anything like that. We want to hear gurgling noises within the patient's abdomen and like gastrointestinal tract. I palpated the stomach. This feels for any hardness, any rigidity, softness of the abdomen, any abnormal hardness and rigidity in any particular areas of the abdomen. I also percussed the abdomen. This allows to hear for dull tones and high-pitched tones as well, if there's any abnormalities in that too. I was able to see, when I went and saw the patient first off before completing my survey and doing everything, the patient seemed to be of normal weight. He was not overweight. He was his stomach was a little bit distended, his mum said, and that it was quite hard on the right side, especially when I palpated it. I found it a little bit harder. His colour was normal. There was a little bit of paleness in his face, which could be from the pain making him feel quite nauseous and quite unwell. His airway was completely fine. It was not occluded or blocked. He was alert and awake. He wasn't unconscious. He wasn't confused, which is all really good signs for the patient. So overall, my conclusion is that the patient was suffering from appendicitis or problems with his appendix, but this would only be confirmed through transport to hospital and examination there.